11. Usually we get some strikers in, but cool, we'll get into it. Awesome. First of all, I'd like to thank you guys for hanging out on Saturday. Some of you have already come and talked to me before, which is great. So my name is Dr. Peter, rehab chiro, owner of Hybrid Spine and Sport. And we are literally like 2 miles down the road, right at 92. We specialize in patients who've tried chiro, they've tried PT, we've done massage, we've done all of the right things, and they haven't found a long-term solution. So we really, like, our biggest core values is we don't just want to get someone out of pain, we want to figure out what the root cause is and give them long-term results. We do that by getting the right exercises that change the movement patterns we do throughout the day. Whenever that happens, then we get really cool results. Does that make sense? As we're going through this too, like, please, if you have questions, please ask. Or else it'll just be me up here yapping the whole time. So having a little bit more interaction is more fun. If you have a question, just raise your hand so I don't just get off kilt to what we want to go over today. Cool. So what we are going to go over today, we're going to go through some of the most common things that we see why people have chronic lower back pain. And I'm going to give you some of my favorite exercises that chiros definitely miss, some PTs miss, like medical doctors, we all kind of miss, that they miss when they come through. So my story, years ago, I was training jiu-jitsu 6 times a week, I was boxing, I was doing all these different martial arts, and my lower back was trashed. I couldn't walk for more than 5 minutes without having to sit down. I tried getting adjusted. I bought a yoga for back pain DVD. I did it. So yeah, DVD, right, as a while ago. I did it so many times. I could probably do the same sequence to this day. It was a ton of stretching, a ton of just gentle movements. But after doing that, my low back hurt worse. And at the time, I'm like, well, no pain, no gain, right? Like, gotta work through it. I went to the medical doctor. They just gave me pain pills and muscle relaxers. So I was like, cool. Now I'm high and I can't drive. Like, what actually was the problem was my left hip. It wasn't a low back thing at all. My left hip was totally stuck. It didn't move well. I had no idea how to actually engage deep hip muscles. So every time as I was stepping or walking, my lower back was trying to propel me forward, right? It wasn't until, like, we fixed the hip that lower back was fine. It was a combination of that and my breathing pattern. I was actually breathing backwards. Sounds crazy. We're gonna go through some tests today to see if you do that as well. A lot of the people I talked to earlier have that same pattern. Cool. So, right now, like, who's in, like, active low back pain? Couple. Okay. Awesome. Who's, like, tried chiro, PT, haven't really seen, yeah, okay. So, what we're gonna go through these exercises and tests today, they're not, I don't want you to come for this seminar and think like this is going to fix your lower back pain. If I could do that, I'd be a wizard and it'd be super cool, but I'm not that good yet. So these exercises are definitely going to help. They're not going to fix, right? Cool. Questions before we get into it? Comments? Anyone want to talk about their deepest, darkest secrets?
So if I come and do this workout here every day, is that going to hurt your back or core?
No. This is great. These are great workouts. What we really want to make sure is we're moving the right way. So as long as we're doing the exercises the right way, it's really good for us. We just have to make sure we're using our deep core. We're actually loading the hips and, a lot of lower back cases. So what we'll do today will help kind of redirect, especially if you're actively in lower back pain or just interested about learning more here. So, okay, so thinking of core, like, what are the first things that comes to mind with y'all? Just anything core. You just shouted out.
Six-pack abs.
Six-pack abs. Cool.
Yeah.
What else?
Bracing.
Bracing. Good. What else? Breath. Breathing. Yes. Good. So most people, when they start thinking about core, that's what they think about. They think about abs, crunches, planks, sit-ups, muscles made for movement that we train in the gym. These are important. If somebody has six-pack, it means they're hungry. Doesn't mean that. Doesn't mean their core is super strong. When you start to think of core, we think of them as two different things. We have muscles made for movement. These are your crunches, the six-pack, the things that we train, which is good. Like we want those to be strong. But then we have deep core. Deep core is our breath. It's the pressure that we need to be able to maintain here all day. If we're breathing, our core should be pressurized, and that pressurized system protects our lower back. Does that make sense? It's really, really common that people, like I was one, do use this backwards. When we use this backwards, lower back is immediately going to start to tense up, and it's going to compensate for this deep core not working. Does that make sense? So at the deepest level, core, we think breath, we think pressure, think like a Coke can. If I have a Coke can that is closed, it's pressurized. I could probably put it on the floor and stand on it, and it would hold me up. If we take the top and we pop it open, or we cut a little hole in the side, I go to stand on it, it's going to collapse. So start to think about your core as this proverbial Coke can. We have our diaphragm that lies on top. We have the pelvic floor on the bottom, and then we have the deep muscle that surrounds us all the way here. All day, this should stay pressurized. As I breathe in, diaphragm should drop down, pelvic floor should drop at the same time, core should expand out, and it should remain pressurized. As I exhale, core, pelvic floor is going to lift, diaphragm is going to lift, and core is going to squeeze in like this. And we just want that Coke can to be breathed and braced that entire time. Hello, it's okay. Come on in. All right, so what we're going to do is we're going to go through first testing core, and then we're going to go through some breathing drills to start getting deep core online. Questions, comments, concerns? You guys are a quiet group. Normally we get more.
Well, the breathing backwards thing is
Okay. Yeah, so breathing backwards. So a proper breath is expanding on an inhale, compressing on an exhale. A lot of people will breathe in and they lift their ribs up and their core sucks in. And then whenever they exhale, they try and push their core out and their ribs drop down. So that's what we call a paradoxical breathing pattern, meaning you're going the wrong way. I see it a ton in CrossFit. It's probably because they all work out with their shirts off. So I'm like, oh, there. Right? But a lot of patients, like if you have lower back pain and you dry needle it, you get adjusted, you stretch, you do massage, you do all of the stuff here, but you never address this and how this should be working, this is always going to come back. It's not until you fix the real reason why this is compensating that you'll ever get results. So, paradoxical breathing pattern, again, is breathing in and feeling shoulders lift. It's a very shallow breathing pattern. It leads to not only lower back pain, chronic tightness through here. It can lead to migraines, shoulder pain, like a ton of different things through here. And it's because these muscles all day are trying to lift in this rib cage. This is like classic, my moms who come in, they're just so tense up here, and it's because they had baby, whether they had C-section or natural. It turned off all of these deep muscles, and then they start breathing up here, and now they're just chronically tight. Y'all will get massages through here. It feels great for like a day. Adjustments feel fine again for a day, but if we never fix the pattern, this is just gonna come back. Cool. Okay. All right, so let's test first. We're gonna do a test retest. So we're gonna lay onto your back, and then I just want you to watch what we're gonna do here. First off, if my ribs flare out a lot like this, it tells us we're not using deep core, right? That's the first thing we're gonna kind of look for. And then we're just gonna do a couple breaths. And I want you to see, does my chest rise? Do I suck in here? Or are we breathing and everything is coming together like this? So let's first start. You're gonna lay onto your back. Hands go onto belly and chest. And you're just gonna do a couple normal breaths and just feel what that is doing. And I just want you to get kind of a gauge for what's happening. Your chest and belly should be rising and falling at the same time. And your core should be a little bit braced. Like if I was gonna come poke into your belly, it should hit a pressurized wall. Okay, so just make a mental note of that, and then we're gonna come back up to sitting. And then, how are you? Yeah. So come on back up to sitting. You're gonna grab a super friend. What was your name?
Yvonne.
Cool. So I want you to sit right here, facing that way. You're gonna cross your feet. So we're gonna do a test with a friend. So Yvonne is going to brace her core by sucking in, right? Our brace should be pressing out. It should never be sucking in. Belly button to spine is like my worst battle here. If belly button to spine can be good as long as we're doing it all together, but most of the time people just immediately activate their abs and then they're very weak in their core, so lower back has to do much. So what you're gonna do with the super friend is she's gonna think belly button to spine, think suck in, and I'm just gonna add a little push to the side. Try and resist that. Okay. Cool. Now what you're gonna do is we're gonna work on a proper brace. So the proper brace is inhaling. You're gonna hold your breath, and it's like you're gonna cough. But I don't want you to breathe out. I would just want you to imagine that same push.
Like bearing down, right?
Like
if you're
bearing
lifting
down.
weights,
Exactly.
Get backward.
Yeah. So we're pressing core out like this. And then what we're gonna do is we're gonna retest. There you go. See how much further, stronger that is? Cool. So you're gonna grab a super friend. We're gonna brace wrong, and then we're gonna brace right, and then start to go through that pattern. Well, how'd that feel? So then, and then there's an odd, jump in. Yeah, so the first one, we're bracing by sucking in. Your friend is just gonna gently push to the side and just feel how that is. And you can sit just cross-legged, you can sit just whatever is comfortable here, right? So I'm bracing in by sucking in, and then your friend is just gonna push on the shoulder. And then you're gonna retest that with your cough and your bear down. Similar to where lifting.
Yeah.
Okay, your turn.
And then breathe.
Who saw a big change?
Yeah.
Yeah. Cool. Super common, that belly button to spine cue just cues us into a back position. So anytime we're lifting weights, if I'm gonna do a deadlift, if I'm gonna bend down and pick up my dog, if I'm gonna step off of this, I need to make sure that I am braced before that happens. That way I can effectively transfer force from lower body to upper body. Yes.
So how do you recommend doing that when it's more of like in a workout setting, like cardio, you know, like the high pace stuff? Because I feel like
You don't
that's
have
where
to
I
think.
notice, yeah, like I can try when I'm lifting weights and stuff, but it's like the cardio days where I really
Or
notice.
just daily.
Well,
How
yeah.
do you,
Breathing about.
yeah,
Yeah.
how do you, like, what extra? Yeah.
Great question. You guys
That's not really a question.
brought me right into my segue.
Oh,
There we go. Very high-tech piece of equipment.
So when I do workouts, I say blow out your birthday candle.
I like that, yeah.
Okay. If there are any other cues that you think would be helpful for us to hear, I think those are the things I'm thinking about.
Okay. Go. Welcome.
Think about it.
Oh, sorry. Okay.
Right now.
So,
You're gonna just hear all of a sudden.
so we want to progress this from laying on your back, doing the drill I'm about to show you, and then we go from like laying on your back doing this, sitting, standing, walking, running, burn. Eventually, this is the way you breathe, and it's normal. Initially, like if you were to go and take a camp or class after this, there's no way this is gonna work. You have to practice it, and you have to retrain that mind-body connection. Protocol, 5 to 10 breaths, anytime you think about it. I'm gonna show you how we're gonna use the balloon to really help lock this in. For me, it feels unnatural to breathe in like that. Like I have to force myself to like lift my ribs up and do that. If breath in here, this is where we should be breathing. A huge benefit my athletes love is they've shown in research 1 breath here is equivalent to 4 to 6 up here. So all of a sudden our endurance goes, because you get so much more oxygen per breath, endurance goes up, heart rate drops, and you don't feel like you're gonna die as much during the middle of the class.
So is that, so like, usually when I see people who are folding over because they're so fatigued, I'll say pick yourself up and breathe tall, because when we bend over, I'm assuming that's where we start to get a lot of the shoulder breath.
Yeah, you're talking about from
Yeah.
this position?
Yeah.
There's no problem with this position as
Okay.
long as I'm not compressing the rib cage.
Okay.
So if I can maintain this stacked position, this is fine to be able, and this helps me support, so I can like find that breath
Okay.
again.
So it's more about what's happening here versus,
Yeah.
Okay.
And the more, if I go here, if you overextend, it actually like it opens up the chest, but it actually makes it harder to use diaphragm
Yeah.
because we're opening up all this tissue and putting ourselves in this overextended
Sure.
position. So like there's nothing wrong with this, just that people tend to do, they overextend. So if I go here and I'm more stacked, that's fine. We just don't want to compress. Okay, balloon. So this is our balloon drill. How this is going to work, and then I just want you guys to watch this first so we can see. So again, if you can hook onto your ribs like this, we're not using core. We need these ribs to disappear. So now I can't hook on them anymore. And we need them to expand with our breath, compress back down. This movement pattern is so like, if you get anything out of today and you work on this, this is like a life-changing type of thing. Like, not trying to like overdo it, but like I've seen patients from like day 1 hurting their back to 20 or 30 years later, and this is what we have to start with. So I'm gonna breathe in. I'm gonna take balloon, and as As I blow the balloon up, the ribs drop and I create pressure. Now I'm going to try and maintain that as I breathe in, expand, exhale, back down. We're going to try and do 10 breaths like that. If I lose it and all of a sudden my ribs stick out again, we're going to come back to the balloon. That helps us activate deep core. We're going to maintain as we breathe in, breathe out. 10 breaths. Questions? Let's get to it. I'm going to come around and help people. If you have a question, please ask. Raise your hand, flag you down. So yeah, totally neutral. We're breathing in. One hand on balloon, other hand over those ribs. Good. And then, so breath in, and then let's blow that balloon up. Good. Feel how ribs dropped in and everything there? Try and maintain that as you inhale and breathe. Push your hands out. Yeah, that's it. Perfect. That little rib pop into it was good. Keep doing that. 10 breaths. Good. Awesome. Breathe in up the mouth. Not up here so much. My hands out on the breath in. There you go. Good. Pressurized. Good. Yeah, really good. Pretty good. How would you feel with this? Great question. Pelvic floor, as you're inhaling, you should feel maybe a little bit of a stretch as it rocks down. As you exhale, it should be lifting slightly. Don't overthink about like a kegel or anything like that. Just try and find how it moves together and stays pressurized. This is so important with patients of ours who have like leaking, with jumping, with things like that. We have to be able to maintain. We have to be able to maintain this pressure with our breath. Yeah, I've had patients before who like got the abs, they look super strong, they come in with lower back pain, and they'll text me the next day after doing this drill, and they're like, holy shit, like my core is so sore. What did we do? So, pressurize by just keeping a hand right here. As you inhale, get that pressure all the way down. And you'll start to feel that. Inhale, get that pressure all the way down. Perfect. How's that feel?
Different. Normally breathe.
The balloon, as a trainer, is a great way to cue somebody really quickly into this.
Okay.
I work with VFT quite a bit, and the owner there keeps balloons in his office for this reason.
Okay.
Push down. Exhale, everything moves down. Inhale, this pushes it out. So this needs to be online. So when you go to pull a box, lower back doesn't get tweaked. How are we feeling with this? So see how as you're exhaling, this is dropping here? Yeah. I want you to, so one breath in, slow exhale like you're blowing up through a coffee stirrer. Let these ribs drop. There you go. Okay, good. Exhale, drop in. That's what we want. We want all of that moving together. Good. Couple more breaths, and then we're gonna check hips. Yeah, really good. Breathe let's come up to sitting. We'll just check. Yeah, really good. How's this feel? Easy? Okay. Again, protocol, 5 to 10 breaths. Anytime you think about it, you want this to be the way we are breathing all the time. Definitely bracing. Think about your breath whenever you're doing exercise. So like, if I'm doing kettlebell swing, I'm inhale bracing, and then moving my exercises with this contraction. Your lifts and endurance will go way up by just getting this online. Don't practice this driving yet, because you get, everyone wants to do it driving, like myself, so you get so much more oxygen per breath, you can get lightheaded. That's what I did driving down 400 in heavy traffic. I got so lightheaded, like I couldn't change lanes. I was like, I need to get off the highway. I just had to kind of grit my teeth and bear it and not crash. So, don't do it while driving. Everyone wants to do it. It's okay once you understand how your body responds. But you'll get lightheaded because you get so much more oxygen. Cool? Okay, so that's part 1. Lower back, deep core, breathing, balloon drill. Get this down, practice it. I swear, like it's a huge game changer. Next, we're gonna check hip. So, if we have one hip that moves really well and is really strong, and we have another hip that's stiff and stuck or weak, lower back is always gonna have to compensate. So this next test, we're gonna do a test, retest. So a simple test is a nice, easy 90-90 sit. In here, I can switch, and then if I switch to the other side, these should feel relatively the same. So what I want you to do is I want you just to check one side, switch to the other, make note of like, oh, my right hip is tighter on this side, or this on this other side.
And you can't like, if I can't get my sit down on the floor on the side, is that this hip is straight or this hip? Right.
Yeah, we're probably missing some internal rotation, which is what we're gonna address here. Cool. So who feels a difference left and right?
Yes.
Yes, yes, yes. Okay. Great. Okay, so this next exercise is tough. I'm not gonna have enough time to come around and check everyone. 5, maybe 6 reps at a time is plenty. It's a really challenging one. And what we're gonna do is we're gonna load the deep muscles in the hip that control how the femur and the pelvis rotate together. So we call this the hip blaster. What we're gonna really look to do is increase hip internal rotation. This is a really common motion that's missing that lower back is always gonna compensate for. So, let me demo this first. So, on my side, my legs are in this hook line position. If you're not sure where your legs should be, if I'm in a glute bridge and just roll up onto my elbow, that's about where they should be. I'm gonna hover my knee and foot equal distance. So I'm not opening the hip up like a clamshell or anything like that. We're gonna brace. Think of your the brace we just worked on, and then we're gonna lift. So we're not just holding the side plank, but we're letting the whole body rotate over that top hip or bottom hip. We're coming up and then pushing our hip forward. So I go back, rotate back up, and then push forward. And what we're doing is we're actually, if we were to take a snapshot of where I'm at now, we're loading this hip into this internally rotated position. And we're trying to get this hip to be able to move.
And it's the one that's on the ground that we're working?
Correct, yeah. The rest of the body is moving over my support leg and back up, forward. So we go back, down, up, forward. Questions? 5 to 6. This is harder than it looks. And if you have questions on it, please ask. Nice, super slow. Focusing on that brace we just did. Making sure the bottom knee and foot remain on the ground. And remember, you're hovering that top knee and foot above one another. Yeah, so getting foot, we rotate down, rotate back up, and then engage the glute to come forward. Yeah, everything rotates together, engage glute to come forward.
We're rotating on the knee, like on the knee, like.
Yes,
Oh, okay,
but,
perfect.
but make sure to keep the foot in place. Yeah, imagine the leg is locked into place and everything else is rotating around it. The slower you go and more controlled here, the better. 5 to 6 per leg. Make note of which side is harder. Equal distance there. Yep. Yep. And then keep this here. Rotate this down.
Yeah, no way, feel the hip.
And then rotate it back up. And then push forward.
The distance should be the same?
Yeah.
Yeah, do the hip.
So keep that foot on the ground.
Oh,
Yeah. And then bring your hips back towards me. And then rotate just as far as you can while keeping that down. Load that hip and then rotate it back up. Forward, forward, touch forward. There it is. So as you come forward, try from under, push. There you go. Good. 5 to 6 per leg. Maybe do 2 sets total. And then once you're done, let's recheck that 90-90 position. Okay. Here. It's good. Rotate back. And drive from here to forward. More. There you go. Awesome. Who has questions on these? Okay.
Definitely harder on one side versus the other.
Okay, that's a big point. It's harder on one side versus the other. That tells us one hip is weaker than the other. When we have one weak hip, lower back is going to compensate. So once you're done, let's retest 90-90. Right? Test this one side, test the other. How's it feel? Same, better, worse after. Cool. Better? Cool. Yeah, that was that. It's good. So, if this made it better, this is a good exercise for you. It means we have a hip imbalance and your hips need to be stronger. If this didn't help, it's also a good thing. It checks hips off the list if you have lower back pain. Right? So, both are good. But again, if this is something that helps, this is starting to tell us that, hey, lower back is compensating for hips. Cool? Good? Questions so far?
So what causes the hip to get tighter, just like straining whatever over time, or like why is that such a common issue?
That is a great question. So it could be every time I step out of my car, I use one leg. You know, if I'm always doing one motion on one leg, it gets overdeveloped on one side. That's part of it. Another thing could be we had a previous injury on this leg. Could be an ankle, could be a knee, and now that hip doesn't want to fire. Right, so I'm a huge advocate for minimal shoes and doing actual foot exercises. We do a lot of foot and ankle exercises in our clinic. 2 years ago, we had a patient come to us. We'll call her Stephanie. Stephanie was in like crazy lower back pain. She was doing chiro. She tried PT. She was a dancer. I found her at a Pilates studio, so she was told to go to Pilates to strengthen. Nothing was seeming to help. She couldn't really. And during our session, what we found is she had orthotics. So in her shoes, she had this nice stiff arch support. And so whenever she took her shoes off to go dance or walk or anything, foot was just so unstable because it's always getting supported. So when foot becomes unstable, what happens is the brain kind of senses that this is happening at the foot, and your brain will then tighten muscles up through here to compensate for it. So we actually fixed her lower back pain without touching her lower back. We just strengthened her foot and ankle. And whenever her brain could sense, whenever she was stepping, like, oh, yeah, my foot is stable, now hip can do its job, so whenever I step, the right muscles are working. But if our brain senses every time I step, like, oh, something's going on here, it's gonna go, tighten things up as we step. So a lot of times, to answer your question, one hip can be an issue because something's somewhere else. So if I've chronically like rolled this ankle, and then every time I go to step, I'm dumping out into it, right? My whole leg is affected. It may not look like it if I'm just standing here, but I'm not able to engage this hip. If I just activate my foot, whole leg changes. Now hip locks in. Now lower back can come in.
Thank you.
Yeah.
When I do the prayer, I sit in this position. Is that going to cause any hip issue, or because I get knee pain here?
Mm-hmm.
When I check with the doctor, he said Leiter syndrome. So then I change to this position. So when I sit in this position and then get up like this, then I feel the pain.
Yeah. If you sit too long in that position with the foot turned in like that, it's going to rotate the shin, and it's going to cause some issues there. So more neutral is better.
Is this better?
Yeah. That's better.
You know, we have a lot of mamas here, so tell us about where we should carry our babies. Because most of us carry on one hip or the other hip. How would you recommend carrying?
Yeah, I mean, ideally switching sides, right? Everyone has a favorite side that they want to sit on and to hold. If you're going to be here, right, like life happens, you're doing other things, we need to make sure we're just switching sides. And then doing the prerequisite core exercises. Because what happens whenever we dump into a hip like that, whether I'm holding a kid or like I'm standing all day like this, is that I'm just sitting on the connective tissue in my hip. My lower back is supporting and holding me up, especially on this side. And then what happens is whenever we go to move again, it's lower back is tight, hip isn't locking in. So the strengthening exercises help prevent that. Ideally, life happens, you gotta carry a kid, you got to. Switching sides is tight. Yeah.
Why do you say that? I never switch sides.
I said that for you.
Yeah, ever.
Always the same.
And car seats too. We tend to carry car seats on the same side, so trying to really and think about your positioning while you're carrying. Are you really leaning to one side, or are you trying to hold that upright posture with your core and the rest of your body doing work? Every time, even just standing around chit-chatting with somebody, do you stick one hip out? Do you wash the dishes with one hip out? All of that can create those balances.
Yeah. And using core, like what we were just talking about, like the balloon drill we just did, now all of a sudden, all day, we're a little bit locked in. Okay, we're gonna do one more. Deadlifts, right? Who is like deadlifting and you're like, oh shit, not for my back. Anyone in here kind of immediately fires it up?
That's in our next mesocycle, so all of us need to pay attention.
Perfect. So let's come on up to your feet, and I actually want you to go shoes off. And we're gonna go over to the wall. Preferably on a harder surface, so we'll use. Okay. So, deadlifts, right, are great. They're great for your back if we do them the right way. We need to make sure that these two main things are on. My core, and I'm loading my hips. Like we just talked about, we load the hips better when we can engage the foot and ankle. So if I'm here, what we're gonna do is I'm gonna keep my butt close to this wall. We have to kind of find like too far away. I'm not gonna be able to touch it. Too close, we're immediately gonna be here. So roughly 2 fists off the ground. We're gonna start with that brace. Inhale, cough like that. Ribs come down, this balloons out, and then I'm just gonna keep my knees bent as I reach my butt back to the wall and tap. And we're gonna try and maintain this position and breathe and brace. Note that my knees are bent and over the middle part of my foot. My legs do not come back. My knees don't come back with me. This just turns into a hamstring stretch, and it doesn't allow me to open the posterior inlet here to actually get into deep hip. So we're gonna use the wall. Again, my hands can stay here. I'm gonna brace, keep my knees soft, and I'm just reaching my sit bones back to touch the wall. I'm breathing, I'm braced. I can feel my foot is active on the ground. And we're just gonna try and engage here. Hold for about 20 to 30 seconds breathing. And then we're gonna start to come back up. Cool?
Yes.
Let's get to it. we got room. Yeah. Yep. I'll make my way through. And then if you have questions, please flag me down. Just start nice and tall. Standing straight up and down. Yeah, so we're standing straight up and down to start. We are bracing our core, holding your breath, and then keeping knees soft as you reach your butt back to the wall. So you're a little too far away. Imagine. Maintain breath here. Just try and find. Going. Good. You're just gonna hold for maybe 15 seconds and then squeeze your butt to come back up. So instead of thinking deadlift, I want you to think more chop back. Okay. Instead of like sitting straight up and down here, more like I'm just reaching my butt back towards the wall. And so your brace is on the way down. We're going to try and breathe here with our breath, and then to come up, strong exhalation as if you were doing that balloon drill. That's good. Strong, super strong. Good. Imagine like you're putting a little bit of pressure on my hands. Yeah, there you go. Okay, come on back up. How are we feeling with that?
When you breathe in, when you're forward like this, like you're trying to kind of expand this area.
Yeah,
Does it like release the tension? No.
Good question. Yeah, it was the whole time this is pressurized.
Okay.
And it's not me breathing forward, it's me breathing in 4 directions like this. Right? You might remember, or some people have seen like the cuckoo clocks, and clock goes off, and there's a little wooden figurine, the guy with the axe, and he's just going, chop, back up like this, right? This is what we're trying to recreate. We're trying to make this core, and everything from pubic bones to the top of my head is like that stiff piece of wood, and then the hips are what lowers me back and then pulls me back up. So it's that position here. What happens commonly with deadlifts is we end up overarching, and now if I've overarched in this position, lower back is always going to take over to come back up. So we have to maintain this stacked position, pelvis and ribs, and then we maintain as we sit back and then come back up. Okay? This, yeah.
Does eyesight help, like where you look? Because like when you look down, you kind of curve your back when you're looking.
Yeah, eyesight helps a ton.
Yeah.
I want my head to follow my spine.
Okay.
If I come down and I keep my eyes on the horizon, I'm gonna start biasing into that extension position again, which is gonna tie into low back.
Okay.
So, yeah, we keep that neutral, straight down, straight back up.
What does the bottom of this deadlift look like then?
What do you mean?
So like, when we cue deadlift, we cue hinge first,
Yeah.
and then to try and get as low as they can to push away, because
Yeah.
we're using dumbbells. So what should we look like at the bottom of the of the deadlift?
Yeah, great
With
question.
dumbbells in our hands.
I tend to cue that same exact thing. So we brace at the top as I'm reaching my butt back until my hands get to about my knees,
Okay.
and then I'm squatting
Squat down
from
to the
there.
bottom. Yeah. And then push through your heels to come back to the top.
Heels and big toe
And big
knuckles.
toe. Yeah. Okay.
Yes.
Okay.
That's such an important cue because as I press into, if I just push through my heels, my feet don't do a lot.
Sure. Yeah.
If I find the inside edge of my heel and the big toe, and I can get into here, now I'm actually gonna load the adductors to come back up.
Gotcha. Okay.
Everyone wants to put bands around the outside of your knees and do side steps and do squats with that. And really we get more glute activation by keeping gentle pressure here. It opens up through the back of the hips more and allows me to actually get into my hips. So I want you to feel that. We're gonna keep doing this. We're gonna brace at the top. And then I want you to imagine like you have a soccer ball here. We're just putting a little bit of pressure in. I'm not me, but we're just getting a little bit of pressure in, and then we're gonna reach back, feel the big toe, feel the inside edge of the heel, and then strong exhalation back up. And you should feel a little bit of adductor activation. It helps us sink deep into that hip. Does that make a difference for anyone? Okay. Yeah, the knee out cue causes a lot of knee pain out here because so Kelly Starrett, he's like the guy who's a PT. He kind of coined that. He's the craziest squat ever. It like hurts my knees to try it. It's not natural at all, and he just cues his squat is like out here. It's super weird. He does a lot of good hip mobility, so it works for him. But we should be pressing our feet through the floor to be able to squat up and down. We shouldn't just be driving knees out. We will take pressure off outside of knee or even inside of knee by actually activating the adductors whenever we squat or step. And it's really counterintuitive to a lot of what we're taught. As long as the foot is strong, then there's no problem with knee in. Cool. Questions on this?
What are your thoughts on for people with limited mobility or more limited mobility with toes out slightly for this?
That's fine.
Okay.
Yeah.
That's
Everyone's hips are a little different,
Yeah.
so like a little bit of foot out is fine.
okay.
Foam
Are you
roller?
looking for?
See if there's a foam roller. No, that's okay.
Yeah, we have no problems.
What
Yeah.
length do you want? I'll grab it.
Just it's okay. Don't worry about it. We'll save it for next time. Yeah. She thought you were running at her. Okay. How are we feeling?
Knowledgeable.
Knowledgeable. Big three. Breathe and brace. Work on this. We have cards for everyone. It has all the exercises written down, so you'll know what to do. 5 to 10 breaths anytime you think about it. At any point during the day, you should be able to pass the poke test. Like if I'm turned, looked over here, and you poke me, it should hit a pressurized wall. That means our core is just always doing its job. 2, need to balance out the hips. That hip blaster, here and up. The side that was harder, do more reps on that side. And that's really going to help you start to control and own this internal-external rotation plus extension. And then spending time to get into deadlifts. I like to teach deadlift on a single leg, but with this many people, it would be a little bit much. So the two-legged version, getting into that, trying to feel activation here, and then really work through it. Again, the deadlift is good for us, right? It's how you pick up your kids. It's how I bend down to tie my shoes. When we're not doing these patterns right, the most common thing I hear is, I woke up one morning, I bent down to tie my shoes. When I came back up, I threw my back out and I couldn't get off the ground for a couple days. Really common, and it's because the lower back has been doing all the work all the time for everything, and eventually it's the straw that broke the camel's back. Eventually just goes into spasm, you can't get off the ground. You can stretch it all you want, you can try needle it, you can adjust it. Those all help, but until you fix the movement pattern, it's going to be a lingering issue. So, that being said, thank you all for sticking around and being awesome for this Saturday. I'd love to come back and do another. I was talking to Sarah about maybe doing a shoulder sometime. If this is interesting to you or you're looking for help with this, like come talk to me. We offer a free movement assessment. It's 30 to 40 minutes. What we'll do is we'll look at your pattern specifically, figure out what we need to work on, and come up with a plan to fix it for good. Patients who come to see us, like we do the soft tissue work. Adjustments where necessary. We don't adjust a lot of people because they make a lot of people worse. But the exercises, the patterns are what get us better. So if you want to take advantage of that, let me know. It's not like a pressure thing. I'm not gonna like try and push you into doing something you don't want to do. Just want to see if I can help you and see if we can help you. So if you guys don't have any questions, thank you all again. Work on these exercises. Haley will have up front have the little card, so just grab a card on your way out. But yeah, besides that, thank you guys.
Thank you.